Zone. I'm Dr. Megan, the Prednisone Pharmacist. I'm here to help you out, answer any questions you might have. I know this is a very tricky medication. I personally had to take it, and I'm a board certified doctor of pharmacy and third generation pharmacist. So I understand what it's like to take prednisone, and I understand it from a scientific perspective. And I try to translate that into usable information for you so that you can take what you need to know about prednisone and use it to make your experience taking prednisone as pleasant and wonderful as possible. This is truly a miraculous medication. Prednisone is one of those miracles of modern medicine that allowed me to live. I was going to die otherwise, but prednisone exists, and I'm so grateful that it does, so that I'm alive and other people have gotten amazing benefit from it. So if you're here, comment below any questions you might have about prednisone or any concerns you have, what your experience has been like. Let's get this conversation started. Let me know what you want to know about prednisone. This is a miracle medication. One doctor who is very well respected said that this is the world's most hated drug. Another doctor at a Harvard continuing education event that I attended, he said that this is the best medication we have in rheumatology, and it's the worst medication we have in rheumatology. So if you feel the same, you have any questions, comments, please drop them in the chat below and we'll get this conversation going all about prednisone. So I want to tell you my story a little bit about prednisone, and if you have any questions or comments, just drop them in the chat. Any questions about prednisone or you want to know more? So when I personally had to take prednisone, it saved my life. And let me tell you how I ended up on it. I was a normally healthy person before this, and then suddenly one day I started getting these little red dots. They weren't itchy, they were flat, they were just suddenly there and just going down my chest. And then they went all the way down my body until my feet started having these little red dots. In addition, I got a bullseye, like a target mark on my arm, and it was so weird. Then I got these bruises that didn't hurt. And eventually they diagnosed me with a reason that I had to take prednisone. If anybody here has any questions about prednisone, drop them in the chat. I'd love to answer them for you. I'll keep telling you my story. So it was super weird that I had all of these red dots and bruises that didn't hurt. So I go to my dermatologist and I say, can you figure out what the problem is? They're like, maybe it's a drug that's causing the problem. Maybe it's that you had an infection last week. I don't know. But let's test your blood. So they tested my blood and they found that my platelets, the part of your blood that's important for clotting, the normal is 150 to 400, and I was way down at 12. 12 out of 400. That means I was a ticking time bomb, ready to bleed to death at any moment. If my head got injured in any way, I could just bleed to death in my brain and die. Obviously, if I'm bleeding to death, I'm dying. So they said I needed to go straight to the emergency room. They tested it again, and now I was 3 out of 400, and it was horrific. I was bleeding to death, unless they did something drastic, and that was when they gave me prednisone. Prednisone was this miracle medication that they gave me that saved my life. It made those platelets go back up. Instead of being stuck, I got to go back up and not be bleeding to death anymore. It was awesome. But as a pharmacist, I knew that taking prednisone comes at a cost. And if you have any questions about prednisone, drop them in the chat. I did not want to take this. But the only reason I did was because if I didn't, I could die. And so I took it, and I took a few precautions, but not enough. Doctors and pharmacists don't understand what it's like to take prednisone unless they've had to take it themselves. I can talk all day long about what it feels like, but unless you've personally taken it, it's really hard. So I'd love to hear any comments, questions, concerns you've had about prednisone in the chat below, and I can answer them for you. I'm Dr. Megan, the Prednisone Pharmacist, board certified doctor of pharmacy. So in the hospital, they gave me prednisone and it brought my platelets up and I was no longer going to bleed to death. And then that started an 8 to 9 month roller coaster ride of high dose prednisone and then my blood crashing and then back up to high dose and then back up. Just this roller coaster with blood tests every week. It was like a part-time job having my autoimmune disease that made me need prednisone. And so if you have personally experienced that how hard it is to take prednisone, how miserable, let me know. Any questions you might have about prednisone, drop them in the chat. So I took the prednisone and I was ready for side effects, but I wasn't ready for what it really felt like. I knew, like as a test answer, that I was going to have side effects from prednisone, but I didn't actually know from a personal experience how it was going to feel for me. Anyone else had side effects from prednisone like me? And the prednisone rocked my world. Hello, says Nina. Hello. Anyone else out there? You want to talk about prednisone and any side effects you've had, any questions you might have? So the first way prednisone rocked my world was making it hard to get restful sleep at night. Anyone else having that issue? Having a hard time sleeping? In fact, insomnia is the #1 tweeted side effect of prednisone. They did studies and saw that all the things that people go on Twitter about, prednisone insomnia was the #1 side effect. And it really rocked my world. And I had gone from being able to stay up late and then just being able to fall asleep instantly and be able to like not have nightmares and not have insomnia. And then I suddenly was having insomnia while on prednisone. Nina said, I always thought it could affect your hearing. Are you talking about prednisone affecting your hearing? Because I haven't heard of that. They actually often prescribe this for people who have sudden hearing loss, or like in one side, for example, or when people have balance issues in their ear. So I haven't heard that it affects hearing loss. But back to prednisone insomnia. It made me feel so lonely. It was just this really tough time, feeling so jittery and like pressured to do something, have all this energy. It was like, I'm going to go clean my whole kitchen. Yes, I have all this energy. Let's do it. But that's so hard when you are taking prednisone to help you in some health way. And normally sleep is going to help you recover from whatever that is. So it's tricky when prednisone is giving you insomnia, but now you're not able to recover from your autoimmune disease or your arthritis. The not sleeping is making your condition itself worse. It's just this catch-22. If you don't take the prednisone, you're going to be miserable. But if you do take the prednisone, you're going to be miserable, which is worse. You're picking your poison here, right? So I personally had no choice but to take prednisone to save my life from bleeding to death. And it was a miracle. It was fantastic. And if you have any questions or side effect concerns you want to talk about, drop them in the chat. I'd love to help answer those for you. And so I was surprised at how miserable the insomnia was and how hard it was to be a nice person because of that, right? Like when mama ain't getting sleep, mama ain't happy. And if mama ain't happy, ain't nobody happy, right? It was affecting my whole family when I was not getting sleep because of the prednisone. Anyone else had that? Nina says, right. Yes. Amen to that. And I didn't realize at the time why prednisone was causing insomnia. It was just one of those side effect things I'd memorized to pass off my pharmacy school exams. It's like, all right, that is a side effect. But there's a reason. And they did a study on healthy young athletes and tested hundreds of biomarkers in their blood. Diane says, yes, it is. Oh, it's a tough thing. So in these young athletes, they tested tons of biomarkers, just one dose of prednisone's sister called dexamethasone, and it affected more than half of their metabolomic markers. What does that mean? It means half of your metabolism, half of the things you can measure that have to do with your sleeping, half of those things were affected. And they said that the sleep-wake cycle was completely shut off. Completely. One dose was enough to suppress your ability to fall asleep and get restful sleep. And so if you've been on prednisone a long time, or if you've been on super high doses, it's tough because the insomnia just makes you feel so lonely, miserable, and harder to recover, right? Diane says, thank you for your efforts to educate the public on this complex subject. I appreciate you. Thank you for commenting. I love it, Dan. What questions do you have, or what concerns do you personally have about prednisone? I'd love to hear, love to help answer any outstanding things for you guys. So what can you do if prednisone is causing insomnia? Well, one thing you can do is you can give back those things that prednisone is stopping your body from making. Your body is not able to take in magnesium as well, and you need magnesium to make melatonin, which is what helps you get sleep at night. They call melatonin the vampire hormone. And so if you don't have magnesium to make melatonin, and you're not making melatonin, you're not restfully sleeping. So it makes sense to just take magnesium, take melatonin, right? Like eat foods that help you absorb magnesium, eat tryptophan containing foods, like we learn about at Thanksgiving, turkey has tryptophan in it. Eat, take dietary supplements that contain magnesium and melatonin and other things that help you feel calm. My favorite kind of magnesium that doesn't cause a lot of constipation or diarrhea, it's called magnesium glycinate. And what's really awesome, yes, Nina, glycinate, yes. Glycinate is because the glycinate comes from the word glycine, which is one of the amino acids that your body uses to build up proteins, right? And glycine itself is one of the amino acids that can cross the blood-brain barrier, and it can go in and help calm you down. So it's not just going to cause the runs, like if you were to take magnesium citrate or magnesium chloride, those would just wipe out your body. In fact, that's sometimes what they use for when you have when you drink the liquid and have to poop it out. There's a word for that, guys. Anyway, so we don't want to have that. This magnesium helps you to have good bowel movements, and it helps you feel calm and be able to build that melatonin and be able to sleep restfully at night. So if there's only two things you do to help sleeping restfully while on prednisone, it's to take magnesium glycinate and melatonin. And if you want to know what dose of melatonin, I recommend somewhere between 1 to 2 to start out with, 1 to 2 milligrams to start out with. And then you can go up from there depending on your dose of prednisone. If it's really high, then you can go up, maybe to go up to 5 milligrams, 10, max of 20, never go beyond 20. Okay, Diane has a question. I hate moon face, trying everything to combat it. I also take mycophenolate to increase the efficacy of prednisone, but it has its own side effects. Yes, it does. I'd love to know more about what side effects of mycophenolate you're personally experiencing, because I don't hear a lot of people about that. I hear about prednisone all the time. But all right, let's talk about moon face. So moon face is when your body redistributes fat from your arms and your legs and puts it on your face, making it so your jawline disappears and you're nice and round. It can just be so much that it's puffy and it's painful. It's stretching your skin with so much rapid deposition of fat on your face. And I personally experienced it, and it was who is that girl I see staring straight back at me, like in Mulan, the Disney musical, right? And it's awful. And what's really hard about it is that when I talked to my doctor, that she was like, yeah, you're on prednisone, you got moon face. Don't really care. And I was like, no. I'm applying to become a professor at a medical school right now. I need to look my best. She's like, sorry, nothing I can do about it. I'm like, I need to have my appearance back. I need to be able to go out in front of the medical students and professors and be able to give a presentation and feel confident that this is me, that I'm doing my very best. And she had no answers for me. She didn't really care. She just kind of brushed it off. Anyone else felt that way about moon phase? That if your doctor even gives you the chance to talk about it, that they're just brushing off moon phase. Yeah? Anyone else? Moon phase? Disregard? Yeah. So that is one of the things I've been on the mission to try to help figure out, because it's not something a doctor should just be dismissing as just vain, because it's a lot more than that. An amazing researcher in France, Professor Fardet, he discovered that people who have moon phase are more likely to have other metabolic complications, more likely to have weight gain, more likely to have high blood sugar, more likely to have high cholesterol, and high blood pressure. So all of that is called metabolic syndrome. So this is an outward manifestation of what is happening inside with the metabolism, leading to an increased risk for diabetes, heart disease, and other complications from taking prednisone. So moon phase is not like, I don't want it dismissed anymore. That's one of my goals, is no more moon phase dismissal. Take it seriously, because it's a signal that your body's struggling inside. It's a signal that the dose of prednisone you're taking is really high. And so step one is figure out with your doctor, and everything I say, I want you to discuss with your doctor. Never, like, this is not medical advice. This is just general health information that you need to discuss with your doctor. So step one is to find the lowest effective dose for you in your condition. Every single person is different. Every person's inflammation level is different. And Diane says, doctor totally doesn't care about moon phase or weight gain. And they should. This is real, right, Diane? Like, this is a signal your body is sending that something is going on inside. So we need to get on the lowest effective dose. That means working with your doctor to taper off slowly to wherever the level is that is safe for you, where your disease is under control. Lowest effective dose. Everyone get to your lowest effective dose if you can, working with your doctor. That might mean getting on alternative medications to prednisone. That might help. Instead, for me, that's exactly what I did. I was able to go on a biologic medication that they also use for cancer. So it's technically chemotherapy or immunotherapy, called Rituxan. And it was amazing because it made my autoimmune disease go into remission, able to get me off of prednisone. So switching to an alternative medication, or like Diane said, mycophenolate, other things to bring the dose of prednisone to as low as you possibly can that's safe for you. And so that's what I did. It was amazing. It worked. It put me in remission. I've been in remission ever since. Then, so we talked about lowest effective dose, trying alternative medications. Next, moon phase is actually one of the symptoms of a nutrient deficiency. Prednisone is stealing nutrients from our bodies. Doctors know this for sure because they know that it's causing osteoporosis from the calcium and vitamin D loss. And like, this is totally like mainstream conventional medicine. Prednisone causes nutrient loss. But most doctors don't know, aren't aware of the other nutrients that are lost. And this one that's relevant to prednisone is chromium. And chromium is a metal mineral you've got to have in order for the glucose, the extra glucose that's floating around, because prednisone's causing you to have too much glucose floating around. You have to have chromium to allow insulin to do its job, to allow the glucose into your cell so you don't have such high blood glucose floating around, leading to all the complications of high blood glucose, right? So yes, Jess says salt and sugar retention. That is for sure happening when you're on prednisone. You're retaining salt, you're having high blood sugars. Yeah. So we need chromium to be balanced in order for our blood sugars to be balanced. Prednisone's making your body to pee out the chromium. It's removing it with the kidneys into your urine. And so now, if you've taken prednisone for very long, you're going to be at a chromium deficit. It's like a plant turning yellow. Like, you don't have enough chromium to have a healthy metabolism. So you need to be giving it back. You need to replenish it. There are some great foods that are high in chromium that you can use, like some nuts, for example, and seeds are good sources of chromium. But it's even easier if you do what some researchers in Israel did. They did a study in Israel of people who actually had diabetes caused by prednisone. And they did an experiment to see what is their blood sugar before taking prednisone. And then while on prednisone, before doing anything. And what is their blood sugar going to be after we do something to them. So what they did is they gave these experimental subjects chromium, a special kind called picolinate, 3 times a day, basically breakfast, lunch, and dinner, 200 micrograms, chromium, chromium, chromium with each meal. And then they tested to see what happened. And their blood sugars were diabetic. And then in about half of them, it reversed their diabetes. And in others, it brought their blood sugar down to a more safe level where their other prescription medications could kick in better. And they didn't have to be on such high doses of insulin or so many oral medications to control their diabetes. And that was amazing that they were able to show a reversal of the blood sugar changes, the diabetes itself. Like the headline of their scientific article is steroid-induced diabetes reversed. Amazing. So replenishing the chromium picolinate is a no-brainer. Every person who's taking prednisone should be on calcium and vitamin D, like those doctors all know, and chromium picolinate at the very least. Like if you don't do anything else while on prednisone to support your body, those 3 are without a doubt clearly being depleted, and you need to give them back. You need to, like my lawn was not doing so well and they gave it fertilizer and now it's all green and lush and it's beautiful. Like we had rain yesterday and it was just so beautiful because we gave the lawn what it needed. It was lush and green and beautiful. And you deserve to feel lush and green and beautiful too by giving back calcium, vitamin D, chromium, and a whole bunch of other nutrients. Okay, Jess says, love your channel. Thank you for your knowledge. You're welcome. And then Nina says, is there a difference between chromium and chromium picolinate? So let me clarify that for you. So chromium, if you see the periodic table of the elements with like all of those little chemical symbols like Ca for calcium and H for hydrogen and C for carbon, all of those different elements in chemistry, chromium is one of them. It's Cr. And so that is when it's all by itself. It's called chromium. It's metal and it's mineral. And then chromium picolinate is how you can actually use it. You can't actually eat chromium itself. Like it's always going to be in a food, or when it's in a supplement, it's going to be bound to something because it's a reactive ion. Like it's actually Cr2++. So it's got to be bound to something. So here's the chromium, and then there's going to be something that it's bound to. It could be bound to a chlorine, or it could be bound to a picolinate. That's this big molecule of picolinic acid. And it's going to be bound to that. And then you can swallow that, and the picolinic acid helps it be absorbed properly and go to the right places. Whereas if it's chromium chloride, it's going to be more of a like solid rock going through your body and not be absorbed very well. So it's got to be the right exact kind, the chromium picolinate. Okay, Diane says, I want to be green. Yes, I want to be green too. And when I was on prednisone, I did not feel green. Not until the very end did I figure out a way to feel whole and complete and lush like my garden and my lawn now that it has fertilizer on it. And that was by giving back the nutrients that prednisone is stealing. And so I invented Nutranize Zone. It's got all of the nutrients depleted by prednisone in it, in the doses recommended by the doctors, the rheumatologists who prescribe prednisone the most for osteoporosis. It's got those in here. Calcium, vitamin D, those are in here exactly what they recommend. Then it has other ingredients to help out with bones, vitamin K2, potassium, and then I've already mentioned magnesium and melatonin, how important those are to help get restful sleep. That's why I have a bedtime bottle. And then it has chromium picolinate both in the morning and in the bedtime bottle. And so this is like going to the garden store and buying a bag of fertilizer for your lawn, right? This is your fertilizer for your body while on prednisone, because you are wilting and yellowing and wasting away. Like prednisone literally wastes away muscles and bones and skin and eyes and hair and teeth. It's wasting you away. Like it's basically causing you to age quicker. And this is designed to give back all of that withdrawal so that you can feel lush and green and complete while on prednisone. So it's called Nutranize Zone. And Nina says she's got it. Yes. So I'd love to hear how it's going for you, Nina. So you can go to nutranize.com and you get, this is one purchase, the whole month supply. A morning bottle where you take 2 capsules in the morning with your prednisone pills, and a bedtime bottle, 2 capsules at night to help you get restful sleep. And it's supporting your bones, supporting your metabolism. It's helping prevent the moon phase, helping with the weight, helping you get restful sleep at night, helping you feel calm with that magnesium glycinate that crosses the blood-brain barrier and helps you feel calm, supporting your mood, helps you have proper energy by giving back B vitamins. All of these things that prednisone's stealing, this is giving it back. It's helping you feel full and lush and green again. So what other questions do you have about prednisone? Let's see. Did I miss any? Okay, moon phase and weight gain. Let's talk about more about weight gain. So I mentioned chromium picolinate, and that's how important that is, because it's giving back what you've lost, what prednisone has stolen from you. So that's a good first tip. Other things to understand about prednisone that you've got to comprehend in order to fight back in the best way possible is what prednisone is doing to your metabolism. So what it is actually doing is mimicking the fight or flight hormone called cortisol. Cortisol was designed by Mother Nature to help us survive disasters. And she wants you to survive this disaster time. And we're taking humongous doses of the equivalent of it as prednisone. And so it's telling you to just go grab that honey, steal it from the beehive, go find those berries, eat it as fast as you can, run and keep going. That's the drive that Mother Nature is going for with cortisol. Just get the food, shove it, and keep running. And so when we live in this modern day, when you don't need to keep running to survive. You have your home that's heated and cooled, and there's plenty of food in your pantry, probably, if you're watching this and you have internet to watch with. And so it's making you prioritize the foods that you could grab and go and get the energy you need rapidly, but it's not giving you the motivation to eat food that's going to help you live a long time. It's hoping you will just eat food that's going to make you survive this moment. So prednisone makes you prioritize high fat foods, high sugar foods, high salt foods, basically Oreos, right? Like the stuff that is manufactured for your palate, for your taste buds, that isn't necessarily good for you. That's what prednisone is making you prioritize. And it's terrible. Like, we do not want to have your body telling you to eat these foods that we know aren't good for you. And then to compound that, the prednisone is turning off the signals in your brain, the hormones that help you regulate your fullness. It's those signals that would say, I'm full, I'm content, I can stop eating. That's what prednisone is making worse. Okay, Nina needs the name again. What the name of Nutranize Zone, or chromium picolinate, or was there something else I mentioned? I'm not sure. Tremor. Okay, Diane says tremors, heart rate increases quickly, emotional dysregulation, ADHD. I'm assuming those are the side effects you're having from the prednisone. And the way prednisone works, those are all typical, because the prednisone is making you jittery, like, okay, get ready, run away from that disaster, right? Like, so it's making your heart ready for the runaway. So the tremors, totally normal. Heart rate increases, yes. Okay, emotional dysregulation. So you're on like hyper alert, I've got to survive, hypervigilant state when you're on prednisone. And going up and down rapidly is completely normal because Mother Nature is not prioritizing stability. Mother Nature is prioritizing getting out of this emergency as fast as you can. And so that's normal and unfortunate. Magnesium glycinate can definitely help keeping that stable. ADHD, I haven't really heard that being necessarily like a prednisone side effect per se, but brain fog for sure is a prednisone side effect, like having trouble with words, not remembering why you walked into a room, where did I put my keys, that whole thing is very normal with prednisone and is another symptom of nutrient deficiency, which is why I've got Nutranize Zone to give back those nutrients. Okay, let's see. Diane says, wanting to eat when I'm already full, so unsatisfying. Nina says fight or flight. And Diane says, my poor husband. Yes, yes, and yes. Your poor husband, my poor kids when I was on prednisone. Yes, it's awful because it's ruining family relationships. Like, you wouldn't believe the number of people who've called me and been like, my wife is getting a divorce and is asking that the court give me no child time at all. Like, my parental rights are being revoked because of what prednisone has done to me. It's horrific. Like, what prednisone does is so awful. Octavia, hi. Okay, so let's go back to wanting to eat when I'm already full, so unsatisfying. So prednisone is turning off that signal in your brain that says, I'm full. And it's called the hormone ghrelin that says you're full. And then it's also having an effect on the GLP-1. Have you heard of those weight loss drugs? Prednisone's messing with that whole cascade of signals too. And so if weight is a real struggle, a Harvard professor I learned from said that the doctors who prescribe the prednisone, it would make sense if they were also prescribing the GLP-1 weight loss drugs to go along with it because it's causing weight gain. The doctor's prescription is causing the weight gain, so the doctor should be dealing with that weight gain, right? So that's another option. After you have gone to the lowest effective dose, found alternatives to prednisone by, trying something else and replenished the nutrients that prednisone steals, like chromium picolinate, then a weight loss drug, GLP-1, is an option. There are other herbs that I have in here that help support weight and metabolism, such as berberine, which someone called nature's Ozempic, and then cassia bark is in here. Both of those support healthy blood sugars. The berberine, I love. It is like basically designed by Mother Nature to counteract prednisone metabolism side effects. I swear, it is so beautiful. So prednisone causes high blood sugar. Berberine helps support stable blood sugar. Prednisone causes high cholesterol. Berberine helps support stable cholesterol. Prednisone causes high blood pressure. Berberine helps keep a stable blood pressure. So berberine is fantastic. There's berberine in here, but I also love, if this is really what you're struggling with, to optimize the dose. You can go all the way up to 1,500 milligrams a day on berberine, and it can do similar things to the Ozempic, the weight loss drugs. It's in the same strategy, the same pathways, the GLP-1 agonist pathway. Okay, what other comments? Interesting topic. Yes, Octavia. All right. What other questions do you have about prednisone? Comment below. Let's see. Heart rate increases quickly. Let's see. Any other comments or questions about prednisone? Let me know. I have 1,500 videos all about prednisone. If I've answered pretty much every question that's ever been asked about prednisone in these videos, so you should check them out on my channel. But if not, and you're still taking prednisone, you definitely need to get on Nutranize Zone. You can find it at nutranize.com. It's also available on Amazon. So definitely get yourself some of this so that you can feel lush and green while taking prednisone. I'm not seeing any more questions, so I'm going to sign off today as Dr. Megan, your prednisone pharmacist.